Good afternoon. My name is Ashley, and I'm very grateful for the opportunity to join and to present today from the traditional, ancestral, and unceded territories of the Squamish Nation. I completed my part-time practicum with the BC Cancer Health Promotion and Prevention team under the direct supervision of their promotion specialist. And today I will present aspects of a shade policy for cancer prevention project that I completed with them. So, for some background, BC Cancer has recently released the Cancer Prevention Indicator Report. It's a very impressive report focusing on the most common risk factors for cancer and highlights existing and potential upstream policy level interventions and actions using the socio-ecological framework to help reduce cancer risk across the province. So, during the first half of my practicum, I familiarized myself with the report and had the opportunity to be a contributor. Later, I worked along with my supervisor on potential engagement exercises and initiatives with health authorities to mobilize the findings. However, my supervisors also knew that I was interested in policy approaches and offered me an opportunity to explore shade policy in BC as a cancer prevention measure. So, sun safety is one of the 8 indicators featured in the report, and better understanding potential policy level interventions became the catalyst for my practicum project. The project had 3 main objectives: to understand how shade is considered in BC planning documents, to create a tool to evaluate planning documents to see where strengths, gaps, and opportunities lie, and lastly, to offer examples of clear policy language that could be actionable for BC policymakers. We saw the opportunity for an evaluation tool to help in establishing a baseline of current shade policy in BC. This evaluation could provide a potential foundation for evaluating policy impacts on sun safety behaviors and skin cancer rates, while also highlighting the overall strength of existing policies and opportunities for more robustness to help close the knowledge gap. I completed option number 3 for my culminating report, a literature review. So I'll share some key findings that help to guide policy recommendations for BC Cancer. I looked at how shade has been researched in Canada and internationally in the last 10 years as an environmental strategy for skin cancer prevention, and to further identify existing policy approaches that support shade provision for sun safety. So the literature identified increasing rates of skin cancer, sun exposure as the primary risk factor, the benefits of natural but also artificial shade for heat mitigation and UV protection, policy gaps and opportunities, the importance of coordination with urban planners, forest services, and public health officials, and we're also aligned on the importance of shade where children spend their time playing outdoors. Additional key themes included overwhelmingly that shade was found to be an effective prevention strategy and increasingly important with climate change, however, often overlooked or weakly implemented in planning. Further, low-income communities often have less shade and poorer infrastructure, increasing health risks. Also, the importance of coordination across sectors was emphasized. Shade is not all created equal, and urban planning is needed to identify the right material for creating the right shade at the right time of day and the right year. And of course, coordination with public health is essential. Australia is once again a leader with comprehensive and effective policy strategies. And shade was further shown to be a cost-saving intervention as outlined here. The aim of the literature review was to explore evidence to support municipal policy-making efforts to equitably prioritize shade planning, not just from a climate and heat preparedness approach, but from a cancer prevention lens as well. So next, I'll briefly introduce a shade policy evaluation method from Ontario. The Ontario Population Health and Prevention Team has a report called the Prevention System Quality Index. This report is similar to the BC Cancer Indicator Report. However, their report also includes a review of shade policies in Ontario municipality planning documents with populations over 100,000, where policies are identified as either strong, moderate, or limited depending on their comprehensiveness and strength of wording. So from the criteria, we can see that, for example, strong shade policy states that shade should be provided for a broad range of municipally and privately owned sites. Looking more closely at shade policy language that received a strong categorization in the Ontario PSQI, this is Kingston. And I've highlighted at the bottom key parts of this where we can see reference to not just shade, but natural and built shade, recognizing the need to understand peak sun times, which suggests the need for shade audits, the impact of shade for resting spots along active transport routes, and the clear rationale to decrease UV radiation. So building on the concept of strong shade policy and drawing on the reviewed literature, I examined 2 municipal documents to provide a snapshot of how shade is currently framed in policy and where there may be room for improvement. And I will just describe one of them here. I created my own process using the following approach to review the plans. The left column is the section of the planning document where either shade or trees were mentioned, or where I saw an opportunity for shade language to be added. The next column, language, are policy statements pulled directly from the documents. In the strengths column, I highlight what is working in the policy or a policy concept that shade could be attached to, so that then in the last column, I highlight opportunities to strengthen the shade language. Langley City has recently completed a shade study, so I thought it could be interesting to see how their official community plan incorporated shade. I reviewed the entire document, which resulted in a large table. So here I included just the 4 times the word shade was specifically mentioned and what that looked like. So the statement in bold here is the strongest in their OCP. This shade policy is missing some important considerations. There are opportunities to use more enforceable language, as well as to reference UV protection and heat mitigation, walkability, shaded seating, built shade, percent canopy covers and density, and well-planned shade for the day and season. Another key opportunity that would align well with the literature is in playground planning. The Langley OCP mentions play areas 3 times, but no policy includes the word shade, so there's a great opportunity here to create a healthier built environment. And embedding shade as a requirement in developers' proposals was suggested in the literature as a strong strategy. On the right, I've offered an example of how to turn this policy into strong shade policy by saying, and shaded children's play areas using artificial or large canopy trees for UV protection and heat mitigation. I identified some broader opportunities and recommendations for going forward, which I presented to the BC SunSafe Working Group. I highlighted opportunities to close the knowledge to action gap that draw on my reviewed literature and use a multidisciplinary approach. So 1, strengthen policy language to be clearer, more enforceable, and better connected to UV protection. 2, plan for both natural and built shade. 3, use planning tools to guide implementation, such as shade audits. Better integrate shade into existing policy and planning frameworks, such as the Healthy Built Environment Toolkit from the BC CDC. And lastly, mobilize evidence showing the more equitable and accessible co-benefits that shade can provide to outdoor spaces. I was very grateful for the opportunity with BC Cancer to develop some public health core competencies. I wanted to deepen my understanding of how policy shapes health, and I'm grateful to them for the opportunity to explore the BC shade policy landscape. This project allowed me to examine shade equity and cancer prevention through a socioecological lens and strengthen my skills in policy development and analysis. As a nurse, I've always prioritized partnerships and patient-centered care, and I've enjoyed extending that collaborative approach to community-level health promotion. Working with my supervisors and public health partners reinforced how collaboration can amplify this impact, and my recommendations further highlight the need for collaboration for better outcomes. This program has helped me to understand how to better contribute to health equity and social justice. It has strengthened my ability to approach issues through an intersectional lens, and during my practicum, I advocated for more inclusive representation and to better collaborate and reflect the cancer prevention needs of the Indigenous community in the indicator report. I really appreciated Javis and Isabella at BC Cancer for taking me on as their practicum student. They were extremely supportive, and thank you to Dr. Daber and Heather Omar and everyone who helped facilitate the placement. And thank you all for the opportunity to present today, and I'm looking forward to the discussion.